Good afternoon. Chris Evans with you here on Guthrie News Page. We'll soon be joined by the governor of Oklahoma, Kevin Stitt, for a COVID-19 update. Today he'll be joined by the Interim Commissioner, Lance Frye, and also Oklahoma Department of Corrections, Scott Crow. Let's go ahead and go to that press conference now.
Good afternoon. Thanks for being here today. I want to give everyone an update on our fight against COVID-19. We're going to focus on how this virus is affecting our prison system. I'm here today with Dr. Lance Frye, our Department of Health Commissioner, and our Department of Corrections Director, Scott Crow, is here as well, and you'll hear from them in a few minutes. As a state, we're averaging about 1,000 cases per day over the past 2 weeks. That number is about where it was at the end of July. And you've got to remember, we've also been fully reopened with no restrictions for the past 4 months. One of the areas we're seeing the most spread in is in our prison system. Most of those cases are asymptomatic, but they still require our attention, and we need to keep working to prevent them. Before we get into the specifics of our prisons, here's a statewide update. Today's data, it's on the screen here from Johns Hopkins University, shows our test positivity rate is at 9.2%. That ranks Oklahoma 14th in the country in positivity rate. And you can see from the map that we're even with or better than most of the states in our region. This percentage, as a reminder, depends on the number of people being tested. So I want to continue to remind Oklahomans to get tested. If you've been exposed to anyone or if you feel sick, make sure you get tested. If you think you've been exposed, remember we've set up the 211 system. So anyone in the state of Oklahoma, you simply call 211. We have 80 different test sites set up all across the state. And as a reminder, the testing is still free. So please, we're reminding Oklahomans to go get tested. There's some positive news when it comes to Oklahoma's recovery rate. And I just want to remind everybody, all lives are precious, and every even one death is regrettable. But it's important to note that we have the 14th lowest death rate per capita. That means 60% more Oklahomans are recovering than the national average. That shows many of our cases are asymptomatic. Do we have that slide up? Can we put that up? Do we have that? There we go. Okay. This shows many of our cases are asymptomatic or have very mild symptoms. You can see the national average. Who's working that? There we go. There we go. Then you can see Oklahoma there. Also want to update you on our hospitals. Hospitalizations, we currently have 628 people in the hospital being treated for COVID. This number is up 106 from our last report on Friday. You can go to the next slide. However, we've identified a few hospitals that hadn't been reporting their numbers. So you can see we have the reported numbers and we have the actual numbers. We have found that between 15 to 87 people had not been reported properly from the hospitals. The health department has been making calls to those hospitals to remind them how important it is that we get accurate data so we can provide that to all Oklahomans. Most of the reports are accurate, and we want to thank all of the hospitals for providing not only this data, but also the PPE data that we track on a daily basis as well. We're still below 5%. Below 5% of our active cases need treatment in a hospital. We continue to have adequate capacity in our hospitals, but we still want, obviously, those numbers to continue to go down. We all have to do our part in the state of Oklahoma. We have to wash our hands, watch our distance, and wear a mask when we can't do that. And remember, it's really important to protect our most vulnerable population. That's over the age of 65. Be careful around those folks. Be careful around anybody with compromised immune system. Those are the ones that are having the most difficulty. And as I mentioned, one of the areas we're really focusing on is the prison system. We know social distancing is difficult in prisons, and extra precautions are needed to keep Oklahomans safe in that environment. To protect Oklahomans in our prisons, we're increasing testing for our correctional staff and our officers. We also know that social distancing for our DOC workers isn't always practical. That's why DOC will be increasing pay for those employees who are dealing with the virus in hot spots across our state. Those folks have incredibly difficult jobs, and it's important to provide them with this little bit of extra support that we can. Director Crow will update you on those details in just a few minutes. But first, I wanted to turn it over to Dr. Frye to give you an update from the Health Department. Dr. Frye?
Thank you, Governor. Good afternoon. Thank you for your time today to provide you with a quick review and update on some of the proactive tactics we've been deployed to further protect the people on the front line and our vulnerable populations. Some of these included issuing a public health advisory with the support of Governor Stitt, asking Oklahomans to participate in activities to drive down the positive cases and keep themselves and others safe, like wearing masks, social distancing, washing hands, getting tested if you have symptoms or think that you've been in contact with someone who is positive or has been exposed. We also included a teacher testing plan, which allows for schools and areas of COVID-19 spread to closely monitor potential exposures within the schools and within their staff. We've been encouraging schools in counties with orange and red level COVID-19 spread to continue mitigation management with things like wearing masks and social distancing. We've activated increased rapid testing for both patients and workers in nursing homes across the state to further mitigate the spread. And today we're here to announce new measures we are working alongside the Department of Corrections to implement in order to keep our prison population safe. OSDH is recommending the DOC mandatory testing of all staff, 25% each week, or at least 100% a month, for their total of 3,300 staff. We're also recommending surveillance and more frequent testing of vulnerable populations, which are about 6,000 inmates. We've coordinated with ODEQ and the DOC to evaluate sampling and analysis of wastewater for COVID-19 surveillance. There will be more to come as we continue to seek proactive and innovative solutions. And now at this time, I want to turn it over to Director Crow.
Thank you, Commissioner Frye, and thank you, Governor Stitt, for allowing me the opportunity to speak with you here today. I think really before I get started, I just want to emphasize that all Oklahoma lives matter. And whether it is just someone in the public or it's someone that is incarcerated in our prison system, all Oklahoma lives matter. And so as director of the department, I deal with a population that is imprisoned. And we've recently had, as you know, a spike in some of the cases that we've had. And every time I learn of a new case, it really makes me sick because this is extremely important. A positive case makes me sick, but an inmate death even makes me sicker. And so one of the things that I've really worked to do is try to place an emphasis on everything that we could possibly do in working with the CDC or the state health department to mitigate this risk or mitigate the current situation or prevent entry into some of our facilities. This problem that we're having is not just about our staff and inmates, but our staff actually work in communities, and so they have families in those communities, and so it's important that we safeguard our staff and inmates so whenever they return to the communities, we are actually helping to prevent the spread in those locations as well. I think one of the things that we've actually really recognized as we've moved forward is that from day one, we have actually offered voluntary testing for all of our staff. We've had some that have participated in that testing, and then we've had others that have not. And as we've worked through with the CDC and the health department, we have been testing our inmate population beyond the requirements or guidelines from CDC from almost the beginning. And typically in our environment, if we have an inmate that tests positive, one inmate that tests positive in a housing unit of say 300, 400, 500 inmates, then we actually quarantined that unit and began testing all of those inmates on those units in a proactive approach to try to prevent the spread. I can tell you what we've done so far is our best foot forward. We are not perfect, and we continue on a daily basis to try to identify resources and new protocols or processes to mitigate this issue. And again, this is something that I take really personal because I want to do everything that we can to safeguard the citizens of Oklahoma, and again, that includes those behind prison walls. And it's difficult. This is a very complex situation for the public. It's even a more complex problem for us in prisons simply because we do not have the ability to social distance as we do in some environments, and we are dealing with a variety of individuals with a lot of different comorbidities or medical problems that complicate the situation. One of the things that I did very early on is as we started looking at our protocols and looking at best practices, up until a point in time, actually, Oklahoma led most other correctional departments in the United States with the number of positives that we had. For a long period of time, we were less than 10. But one of the things that is absolutely true is that whenever we create policies or develop protocols, then we have to make sure that those are being followed and enforced. And so I developed a team of DOC staff that work in the DOC administration building that actually monitor cameras in all of our facilities remotely on a daily basis, covering 24-hour spans of operations in those facilities to make sure that we are actually doing what we say that we're going to do. And that is wearing the mask, making sure that people are tested or screened at the entrances to our facilities. All of the things that you see on our website that are operational guidelines or requirements, those are the things that we're looking for to make sure that we're doing what we need to do. Are there issues of non-compliance? Yes. Because we actually have 3,300 correctional officers and close to 25,000 inmates today. So there are going to be compliance issues, but I can tell you that every time we identify one of those, we respond to it very quickly with corrective action. Sometimes, just as we see in the public, especially with our inmate populations, they're adverse to actually wearing masks, and so sometimes that creates a bit of a challenge. But I can assure you that we continue to monitor that on a daily basis, trying to make sure that we do everything we can to safeguard our inmate populations. Today's statistics as far as our testing numbers go, to date we have tested 590 staff, 278 cumulative positives, 63 current positive. We've tested 14,010 inmates, that's 64.3% of our total population. Cumulative positives was 3,168. That's 14.5% of our population, and current positive is 1,398, which is 6.4% of our population. 92% of those today are asymptomatic. That is a moving target. That has been as much as like 94% and as low as 91%, and that's basically based off of our medical staff at our facilities and our other staff screening inmates on a daily basis on all of our housing units to make sure that we identify those that are symptomatic versus those that are asymptomatic. And so again, that number today is 92%. We currently have 22 inmates hospitalized. That's 1.6% of our current positives. And those are at various levels of needing medical care. Unfortunately, we've had 9 inmates that have expired or died as a result of COVID or COVID-related illnesses. All of those individuals actually had comorbidities that contributed to their deteriorating health. That again is the number that absolutely makes me sick, because I remember when we had 0, and it was my goal for us to continue or hopefully maintain 0, but unfortunately that number has increased. One of the things that we've done in addition to all of the previous efforts made is to identify what we refer to as hotspots. And about 2 weeks ago, I tasked my medical services unit along with other DOC members to actually identify hotspot response teams. And basically what hotspot response teams along with hotspot protocols or criteria. And so currently we operate under a system where if it is a celled housing unit, which basically means we have individual cells in the housing units, if 20% of one unit or 20% of that overall housing unit or population tests positive, then it becomes a hotspot. in open dorm units, like in many of the instances we currently have, like at Eddie Warrior, for example, William S. Key, those are open bay housing units, and in that instance, 15% positives designates that unit or that facility as a hotspot. When we refer to a hotspot, our medical staff also have the ability to designate a hotspot based off of the medical acuity level of the unit, based off a known vulnerability of the population and the number of staff positives, along with other factors increasing the risk of infection and spread. Hotspot designation actually triggers an additional response from the department, because one of the things that I recognized early on is in planning for this, if we got to a point that our staff were overwhelmed with the number of positives, or we had a number of staff that were actually out with illness, what would we actually do? I mean, and so when we started looking at how we would support operations such as medical, food service, and security, then we started trying to identify what that resource would look like without having to pull from one facility to help assist another. So we established what we refer to as a rapid response unit, and basically that is a unit that is comprised of officers from different support units across the agency, primarily our K-9 unit. And so when we deploy that team, they are actually not being pulled from the resources from other facilities that may need them for their operations. And so once this team responds, there's actually someone from the team that is involved strictly with sanitation. They actually bring in additional foggers for sanitizing the units and the different areas of the facility. We bring in a unit that actually is involved in providing support for security, providing support for medical services, providing support for food services. And like in the instance of food service, I can tell you today, all of our inmates have continued to receive the same level of nutrition, which is reviewed and governed by a licensed dietitian nutritionist as they had as we provided prior to COVID. And so that is very, very important. But one of the things that this team does is it allows the facility administration to actually focus on the core operations while this additional team comes in and helps support those operations. One of the things that's really, really important in the prison system is the ability to isolate and quarantine positives. And so we continue to maintain bed space across our system where if a facility has exposure, but we, in the process of testing those inmates, we're awaiting the results, then we place those inmates in quarantine status. And then when they become positive, we actually place them in isolation status. In some instances, we've actually had complete units that are in quarantine or complete units that are out in isolation, such as the case at the Eddie Warrior Correctional Center. So all of these things having been said, there's a lot of things that happen behind the scenes to try to continue to mitigate the situation. And really, most importantly, I, on a daily basis, continue to review all of the literature that I receive from other correctional agencies. I'm a member of an organization called Correctional Leadership Association, and they actually put forth best practices in correctional facilities. And so we continue to look for ways to improve on what we're currently doing, and again, to mitigate the spread of COVID in our system. Thank you.
Thank you, Director Crow. Thanks, Dr. Frye. Our Department of Corrections was really a national leader early on in this pandemic, and I'm confident Director Crow's team will continue working to bring these cases down across the state and keep our inmates and all the staff safe. I was on a call with the other governors and the vice president yesterday with his coronavirus task force, and he wanted me to remind and pass on a message to all of our college students and their families. If you test positive, we really need you and want you and implore you to stay on campus. Your school has a plan to make sure you're isolated, but still get whatever care that you need. I have a daughter in college, and so my wife and I can relate to wanting your children at home if they tested positive, or just wanting them at home anyway. But please, once you're on campus, please stay on campus. This will allow us to contain the spread of the virus around the state. And remember, most college students are asymptomatic. And as a matter of fact, in Oklahoma, 99.99% of people under the age of 25 have recovered from this virus. Students, if you do come home, please be very careful around family members and especially anyone that is vulnerable or has a compromised immune system. Our colleges and universities in Oklahoma all have plans in place to manage this virus and keep their students safe in place. And I know that many hours have gone into putting those plans together for the school year, and I'm grateful for that faculty and for all the planning that they've done. So with that, we'll just open it up to a few questions for Dr. Frye, myself, or Director Crow. Yes, ma'am.
State officials have described a county reaching county reaching red as nearly impossible under a four-party system. Why use a different system in the White House? And isn't that confusing or maybe misleading?
Yeah, I'm happy to answer that. That question keeps coming up. We're not using a different, we have the same criteria that the White House uses for numbers per 100,000 in a population in order to move from level to level. We have tried to simplify that as much as we can by sticking with that measure. What is different is our orange is their red. We intentionally added another color. We added orange in there because we wanted red as an internal monitor for us to use for the state, the State Department of Health, in order to basically warn us that we're going to have to get with the governor, discuss some other actions, like maybe an executive order to stop elective surgeries. You know, are we going to have to start? We're going to have to maybe look at sending ventilators or helping them transfer patients. You know, just different measures for us to really have to activate our emergency plans that we have in the Department of Health. But otherwise, the map is the same. It has the same cutoffs. That is just an additional one for us to use for emergency measures. And we aligned that recently with our new updated surge plan so that it made more sense to do it that way.
Go ahead, Joe. Commissioner Frye had some recommendations, including mandatory testing of staff, wastewater testing, and more surveillance if things were vulnerable. Will you guys be taking all of those recommendations?
Absolutely, yes, sir. There will be information in a press release that's forthcoming probably tomorrow that states that we are going to be moving forward with mandatory staff testing, that we are also going to increase testing of our inmates with those vulnerable populations, as he mentioned. So yes, sir, we are taking the recommendations, all the recommendations from the health department, and we'll be moving forward those.
What are the mandatory staff testing in place already?
One of the things that we understood very early on is when we started, as I mentioned earlier, we started voluntary testing of our staff, allowing that or having that availability. And for the most part, most of our staff were actually participating in that to a certain degree, but we feel like that as we've moved forward and we continue to see increases in the number of positives that we have to take another step to be more proactive, and that is basically mandatory testing of all of our staff. And one of the things that we was concerned with early on is the legal mechanism or legal ability for us to be able to move forward with mandatory testing, and we now believe that, or don't believe, we now have the framework in place in working with the health department to ensure that we can confidently do that, and that's our plan moving forward.
Director Crow, as you can imagine, having an inmate, a family member, they're probably frustrated. We've heard a lot of concerns from family members. What would you say to the families of inmates of outbreaks?
I would say to the families, as I say almost on a daily basis, is that, again, all lives in Oklahoma matter, including those that are in our prisons. And there are a lot of rumors and speculations of things that are happening within the prisons. But I can tell you that I absolutely am in tune with everything that we're doing on a daily basis to make sure that those core services are provided. And above that, I'm making sure that all of the medical needs are addressed at our facilities, that each have their own medical unit and actually have a doctor or a nurse practitioner or physician's assistant there. And at the first sign that we have an inmate that reaches a point or a level of illness that requires services beyond what we can provide at the local level, those individuals are transferred to ERs immediately.
Director, is it 25% staff will be tested each week for a grand total of 3,300 staff members? Is that the entire DOC staff or just institutions?
No, sir, that's the entire DOC staff across the agency.
What kind of tests are you using?
Who's responsible for contact tracing? Is it the DOC or the health department?
It's a coordinated effort with DOC staff in coordination with the health department.
Are you fighting vectors of transmission? Is it staff or is it other people that are coming in from other facilities, or what's the main way that it's coming in these facilities?
I think there's a couple of different variables that play into that, and I'd like to take a moment just to speak to that. Is that very early on, you probably remember, again, our numbers were very low, and that was because we had halted all receptions from county jails. We had ceased most transfers from one of our facilities to the next to again understand this COVID virus and understand the impact that was going to occur not only in the public but in prisons. And so that model was not sustainable long term, simply because the judicial system had to a certain degree paused. There were court proceedings had paused, but once all of those processes resumed, then DOC is a part of the judicial process. And there is something called the 72-hour rule in the state of Oklahoma, which allows counties, when they reach a certain capacity, to actually invoke a rule that requires DOC to actually bring in receptions for inmates that are beyond their capacity. And so, working cooperatively with the Sheriff's Association and sheriffs and the DAs across the state, we were actually able to pause that for a certain period of time. But of course, as things have started to resume into somewhat of a level of normalcy, then we had to start receiving those inmates and start processing. And so if you take that, with us receiving county jail receptions, those inmates are tested prior to coming into DOC. But even so, as we've mentioned many times before, and I'm sure you've all heard this, is a test is only good for the day on which it was administered. And so there have been inmates that we have actually brought into the system that tested negative the day before they came to DOC, and then a day or two after they were brought into DOC, they tested positive, because all of those individuals are actually placed in quarantine before they actually end up at the location where they're going to be permanently housed. And so if you take that and you couple that with the fact that we've closed 2 prisons in the last 60 days, a 1,650 bed facility in Cushing, Oklahoma, and then we also consolidated a couple of our facilities, our female facilities, and closed the Cape Bernard Correctional Facility here in Oklahoma City. We transferred those inmates, and in those instances, those inmates were not tested prior to transfer simply because they were already a part of our populations that were being monitored on a daily basis for symptoms. And then in addition to that, then of course, going back to your original point, is that all of our staff work in the communities. They all work in the public, or all live in the societies where our prisons are located or outside of those areas. And so when we've seen an increase or a spike in the number of cases in the public, again, our staff are a part of that, and they come to work on a daily basis. And I believe all 3 of those variables have actually contributed to an increase in the numbers that we have.
Commissioner, I have 2 questions for you.
Yes, sir.
Are you using rapid testing, or are you doing the nasal swab, or a mix of both?
We're using the nasal swab at this point in time. We have been in communication with the health department to look at the potential for rapid testing, but we're using the nasal swab at this point.
My second question for you would be, does DOC have a compassionate release, and would any of the 9 that have died qualify for any kind of compassionate release?
There is a system for medical paroles in the Department of Corrections that's pretty complex. There's a lot of variables that go into play there. As to whether the 9 that actually died would have been eligible for that, I really can't speak to that today, because again, there's a lot of variables with respect to violent crimes, with respect to sex crimes, and a lot of different things that actually go into those considerations. I can tell you that we continue to look at those cases and to try to identify those that we could potentially put forth to the Pardon and Parole Board, but that's a pretty complex process, because there's one side that is absolutely in support of the compassionate or medical paroles, but then there's the other side that consists of victims, families, and prosecutors that have concerns with that as well. So there's a happy medium there somewhere, and again, the qualifying criteria becomes a bit complex.
Does the illness develop so rapidly that the system takes too long, would you say, or?
I think that would be speculative on my point. In many of the instances where we've had inmates that have expired, they actually went to the hospital for other comorbidities, and while they were at the hospital, they tested positive. And so, to date, of the 9 that we've had die, only 2 have been confirmed as the death being directly related to COVID.
How you're isolating inmates at facilities like William S. Key and Jackie Brandon at COVID dorms. You previously had said that you were infected inmates being kept away from healthy inmates in a different wing or building. with 100+ cases at those facilities now, that doesn't seem like it's super feasible.
It is very difficult to do, and what we end up having to do is identify housing units specifically for that purpose. In some instances, we have restricted housing units or segregated housing units that we use those cells for the isolation piece. And if we get into a situation where the capacity at any given facility is reached, then we actually can transfer those individuals to other facilities that have that capacity.
And have you done that? Have you been having?
We have not had to do that so far. But I'm going to tell you, there have been instances where we've been very close to that, like in the instance of Eddie Warrior. And the thing that was unique about Eddie Warrior is the numbers increased so significantly, so quickly, that instead of having to isolate them away from the rest of the population, most of that population was positive. And so then we actually had whole housing units that were isolated.
Director Crowe, how many hotspots do you have, sir?
Currently, the facilities that we have that are hotspots, let me get to my numbers here. I believe it's 6. I'm sorry, I'm thumbing through my numbers. The current facilities that are hotspots are the Eddie Warrior Correctional Center, which is a minimum security women's facility in Taft, the Joseph Hart Correctional Center, medium security male facility in Lexington, the Northeast Oklahoma Correctional Center, which is a community level correctional facility in Bonita, Bill Johnson Correctional Center, which is a minimum security male unit in Alva, the Jackie Brannon Correctional Facility, which is a minimum security male unit in McAllister, the North Fork Correctional Center, which is a medium security male facility in Sayre, the Enid Community Corrections Center, which is a community level facility in Enid, Oklahoma, and then last, the William S. Keith Correctional Center, which is a minimum security male unit in Woodward, Oklahoma, or Fort Supply, basically.
Director Crowe, there have been some families that have complained that their loved one in jail or in prison have not had access to a phone call. Can you kind of talk a little bit about, this is really complicated, and when places are locked down, they probably aren't going to have access to a phone when they want to use their phone.
That's a very, very good question. That's something that we recognized very early on, because one of the things that in corrections, again, when I talked about the complexity of the situation is trying to manage the COVID process, but also trying to continue to manage the inmate population for security issues, for violence, and all of those sort of things. And so things like telephone calls or things like visitation with families is extremely important. That's why very early on we partnered with our then telephone service provider to provide 2 free telephone calls per week to each of our inmates. That was free of charge to the inmates off of the paid for telephone service that they typically have to pay for. And so we maintained that service up until recently, whenever we transferred to a new telephone service provider. That telephone service provider has now picked up the same offering, and now our inmates continue to have 1 5-minute call per week to their families. And so they all, even if they're on the lockdown status, those phones are actually on those housing units, and they're still able to make at least that 1 5-minute call per week.
Hi, I have a question for Director Crowe and also Governor Stitt. I wanted to know if you were considering asking for any executive action to release people from prison who are near the end of their sentence, like say 60 or 90 days, and is that something you could ask the governor's office to do, and has the governor's office considered doing that?
I can tell you, even prior to COVID, back in November of last year, you probably remember the commutation process that we went through, where we released close to 500 inmates or so. And so we continue to look for ways to actually transition our inmates back into society, into meaningful roles with their families. But again, that's a complex situation, because a lot of times there's limiters with respect to their types of crime, with respect to the amount of time that they have remaining to serve. We currently have an initiative where we're looking at a couple of possibilities that is too preliminary to speak to today, but we do continue to look for ways to release inmates that are doing what they need to do in prison to return to society as mothers, fathers, or meaningful citizens to better their lives. And so the governor's office has worked very cooperatively with us in that venture, and continue to do so. Governor, would you like to speak to that?
Director Crowe, I'll give you a little break there. They were pounding you. So yeah, just to echo what he said, I know that our Pardon and Parole Board and also our district attorneys have looked at any nonviolent person that's in prison that has their 3 months to 6 months left. So they're looking at that to see if it's possible to do another commutation for those folks. But we've got to follow the law. Public safety is number one importance. And just to echo, he's done a fantastic job. Our partner parole group has done a great job. When I took over as governor, we were number 50th in the country, last place in total incarceration per capita across compared to every other state, and now we're number 47th. And I don't know if you caught that, but because of some of that work we've been able to do, he was able to close one of the prisons down, 1,600 private prison, which was in where was it? In Cushing, yeah, 1,600 bed private prison we were able to close down, which saved the taxpayers, I believe it was $24 million. So we're obviously looking at that. Pardon and Parole is actually looking at that right now.
Governor, just to clarify those remarks, so are you saying that most of those who would have qualified for a commutation were released as a part of the big program that happened last year, and so we have mostly just the bad guys and the violent guys in there now?
I'm not going to say we have we've released all of them. I would have to look and see if they've gotten through all of that 781 commutation. That's what we called it. A big, 450 of them, I believe, was the number that was released on November 1st. It was the largest commutation in U.S. history. And I don't know. I know that we went through another 100 a couple months after that. I don't know if every single one of those have been out by now or not.
Can you just give us some more detail? What was this issue with hospitalization reporting exactly? How many hospitals are having issues, and how has it been resolved?
It's not been uncommon for some hospitals to not report, especially on weekends. So when the staffing is down, the hospital, sometimes it gets missed for some reason. And so occasionally we'll have zeros come across in the reporting tool that they use, and then the next day they'll be back up to their 50 or 60 or whatever they might have in that facility. And so over the weekend that did occur. I'm not sure why we had several on the same day, but those all happened on the 20th. I believe it was 10 different facilities that had zeros where we knew they had patients the day before and they had patients the day after, so we know it was a mistake. So we immediately assigned several people to call all those facilities and make sure that they're confirming their cases every day and reminding them to make sure that they get those cases reported correctly.
Governor, can I ask why you're not using CARES Act money to fund the hazard pay for correctional employees? There's been an increased pressure on you from various groups to use it.
To use CARES Act money to do what?
To pay for the hazard pay for correctional employees who are working behind the bar bench right now. From my understanding, the GOV only has $1 million to pay, and it doesn't seem like it's going to go super far.
I don't know specifically why we didn't use CARES Act dollars, but there's a lot of state agents, state employees that are well deserving, and we have to make our dollars, stretch where we can. And we thought it was important. He had it in his budget, and so we authorized Director Crow to pay this hazard pay for hot spots. If you remember, also in the 2019 session, we gave all the correctional workers, we brought them up to kind of the market average. I think they got 16, they got 2 pay raises to bring them up to the market average. So I think it's very important that we pay market. And we've had some requests all across state government to do hazard pay or folks that are dealing with the public. And we just you don't have the money to pay every single person or give somebody a raise because they're in perceived kind of in the line of duty. But this in the hot spot in the red zone, like he said, in the hot spots in the 6 facilities, we thought it was important to give those correctional workers a pay raise. He had it in his budget, and so that's the way we chose to do that.
We can follow up again. Are you still able to contact you?